Today we have two very special panelists. We've spoken to them before, but they are always full of incredible information that our veterans need to hear, and you and the general public need to hear as well. So our first person is Brent G. Filbert. He is a Pentagon retired 30 years U.S. Navy veteran, professor and clinical director for Mizzou Veteran Clinic of the University of Missouri School of Law. We also have a Dr. Amy Bolton Beebe, and she's a psychologist with years of experience working with rural veterans who currently examines and treats veterans in Tennessee. And their discussion today will be involving treating veterans in rural areas. And our veterans, when they come back from combat, when they come back from service duty and go back into the rural community, we cannot afford not to hear them and not to know that they're there and they need our help. So I am honored to have both of you on today. So who would like to start, Brent or Amy?
I'll go ahead and start.
Okay.
So we have a great treat today because in the past when I've asked guests to come on the show, we've had people in different areas with different backgrounds and specialties. Today we have Dr. Bibi, who is a clinical psychologist who is actually involved in the examination and diagnoses of veterans, and in particular, a large part of that is rural veterans. So I thought it'd be great to have somebody come on who really has dedicated a significant part of their career to working with veterans who have mental health issues, which is a very unique thing to do. And the rural veterans have their own unique challenges and mental health aspects that are different than veterans in other parts of the country. So I'd like to welcome Dr. Bibi to the show. She has a tremendous background and also is quite honestly, is a good friend. So she has both those things going for her. So, I just wanted to introduce Dr. Bibi, and maybe if you could ask her about her background generally, how she became a clinical psychologist, and what does she do in terms of working with America's veterans.
Oh, fantastic.
Well, as soon as I open my mouth, you'll know I'm from rural Arkansas. So,
sounds beautiful to me. Music to my ears.
and my PhD is from the University of Southern Mississippi. So I can't get any more than that. But not to try to correct Brent or anything. I actually started out working with children. I spent 25 years as a child and adolescent therapist before. And did a lot of forensic work in that area before this kind of, and I say, fell into my lap. And I discovered that there's not a whole lot of difference between veterans and child and adolescent, because I am still dealing with people who don't want to talk about their issues or don't have the words for it to put with the feelings and are scared to death they're going to be crazy. So it was actually an easy transition to go from child and adolescent to veterans, not to put down the veterans or anything, but again, it's dealing with a population that just doesn't have the words always to go with what they're feeling, and very guarded and protective of their emotions.
Oh,
so
yes.
So and I also don't do the treatment, otherwise I wouldn't have time to do all the exams, and I've done probably over 2,000 exams, CMP exams for mental health for veterans over the years.
Oh my goodness, 2,000! That's a tremendous number.
Well, if I don't have veterans to see, I get to go fishing, so I haven't had to drown worms. I haven't had much of a chance to drown worms over the past few years.
But what do you find? Do you find it's more difficult to treat veterans in rural areas than let's say that you were in a major city, Chicago, or in L.A. or those kinds of things?
Well, actually, it's hard to say. I'm in Memphis, which it's not a Chicago or an L.A., so I really don't have a lot of the really urban big city stuff to compare to, because the majority of my veterans come from, because of the uniqueness of where Memphis is, I pull from Arkansas, Mississippi, and Tennessee, which, outside of Memphis, Nashville, Knoxville, Chattanooga, some of those other places, we're in the middle of the sticks still, and so the challenge is to get, because as country folk, so to speak, rural, we tend to be more self-reliant and not wanting to talk to people or rely on people for help. And if we ask and the answer is not right, and you get you don't ask again.
Oh, right.
You just say to heck with it and go take care of it yourself. So it's and a unique challenge for anybody, rural or urban, is mental health, because there's such a stigma with that, and it's generational. But rural, Brent and I were talking about this earlier, we tend, and I say we, even though I live outside of Memphis, I still grew up in the middle of a rice field, so I say we, just don't have the exposure. And with exposure, and it's all there, have access to the same services that veterans in Chicago, New York, Los Angeles would have, and without that exposure to see how the process goes, very reticent to experience it. And that's what those city people do. We rural folk don't do that, kind of stuff. Yeah,
and it sounds like that first encounter is really critical. When someone is coming in, because if they get turned down the first time, they may never resurface again, right? From what you're saying, yeah.
Well, if they get turned down or have a bad experience with an examiner, and another thing that before this, Brent and I were talking about, that a lot of veterans don't know or understand, if they walk into an exam, and if for any reason they feel they are being minimized, disrespected, not their concerns are not being addressed, they can get up and walk out, call the company, no harm, no foul. And that's if it's a third-party contractor or at the VA. Now, you can't get up, throw the table, and walk out, no harm, no foul. But you can,
no, you don't want to do
that. But you can get up and leave and call the company and say, no, send me to somebody else. Because, there are times that you just can't make that connection, and it's through nobody's fault. And it just, and if you feel like you're batting your head against the wall, they can leave.
Yeah, because I did a couple of tours in Iraq, and I remember, from the first tour when I came back, that the person, there was a staff sergeant that came in. We had 300 people, shoulder to shoulder in a room, and they looked at us, and he walked in and he said, "Okay, does anyone have any mental health problems here? Anyone crazy in this room?" And, of course, a few people raised their hands, and that was our psychological screening coming back in. And they said, well, if you do have a problem, you're going to have to stay here for a month or two. And we were like, out of here.
Exactly. No problems.
That was our screening.
Yeah. So, Dr. Bibi, that raises that's a question that I think I wondered if you see that, where when you're examining veterans, it's because you've been asked to do that by the VA, via a contract. But how common is it to see veterans who are obviously out of service, who are having mental health issues, and that's why you're examining them, but in their actual medical service records or military records, there's no indication whatsoever that they were having mental health problems? Is that common?
That is more common. That is more the rule than the exception. A lot, and it's from Vietnam era on, because just what and I forgot what your name is.
Oh,
host. I'm
Dr.
so sorry.
Arnold. Dr. Arnold. Sure.
Oh, sorry. I got the Colonel part, but I after Colonel I blanked.
Oh, that's fine.
I'm so sorry. Oh, well, But because what you just said, they are disincentivized to have any complaints when they come back from combat. Because if you have complaints, they have to be addressed, which means you stay on base. You don't get your leave. You don't go. You don't get out. You don't get to see your family. It has to wait till that be addressed. And then coming out of Vietnam, there just wasn't any of that, And it's been several years ago, I was in a training or something, because when Vietnam veterans left, they sometimes had their records with them, and they would go and read those on the plane on the way home, and anything that was unfavorable, they would pull out and kind of hide. But on those pages where they well, if they had a problem with, venereal disease or something, they didn't want that going back home with them. But on those pages, they would also pull out things that were necessary for their claims 20, 30 years later, but who knew? So sometimes it's like being an archaeologist in the records for these veterans to find some hint, some clue of something so that we can do that service connection.
Oh, fantastic. And what would be a recommendation to service members as far as, because some people who are still in service now, and we have veterans, that, approach you, but as far as their medical records, maintaining those or making sure they document things, how important is that?
That is, because the VA requires a level of proof for forensic exams, which are what C&P exams are, that is not required in regular clinical or treating exams, then it's pretty vital to have some kind of crumb trail of something that happened in service in order for examiners like myself to be able to prove it occurred in service. So usually the ETS exams are the best place to do that because you're getting out, so it doesn't matter what. But if you've ever had any trouble with sleep or any physical issue, put it on that. So even if there's nothing in the records where you didn't have treatment, at least it's on that legal document in the ETS exam or the separation exam or retirement exam.
Right. Yeah, because they I guess when we were being brought back stateside, you did have to go through and, fill out questionnaires and those kinds of things, and people should. Yeah. Yeah.
Post-deployment health assessment. Everybody just runs through and goes, no.
Yeah, yes, right, and that's probably not the best thing to do if you really have something happening.
Yeah. But I do think I would tell any veteran or anybody getting out of service. It can be difficult when you're in service, but if you can make a copy of your medical record and have it when you leave service, it can save you a lot of problems down the road, because it's amazing how many cases we have at the Veterans Clinic where one of the biggest issues is there are no medical records from the service, or the military records are really just either stripped or gone. I mean, I have cases right now. I have a Vietnam veteran right now where there's not one military record of his service, and he served 2 tours in Vietnam.
Wow!
So that is a big issue. So I wanted, if you don't mind, I'd like to ask Dr. Bibi the examinations you do, and then how are they used by the VA? We often talk on the show about disability compensation, where a veteran's been injured in service, has some, for you, a mental health issue, and they're trying to get some disability compensation for that, because that's what their right is, and that's the promise they were made when they served. What happens to your exam, and how's it used by the VA once it's done?
My understanding, because once I send it, I don't get to track it. It's the VA says this is one of many, that they use to make the determination. Many factors, plus service records, plus treatment records if there's VA or private treatment records, lay statements. It's all part of that. But our exams require the documentation to be listed and to provide. That's what the VA calls the Nexus. Now, to me, the Nexus is that big chain in the neutral zone on Star Trek. So I had to learn that whole new term. But to be able to draw the path from started in, was incurred in service, and has maintained to date. So if that is written well, then that really combines all the information that an examiner would have of the records, and also in one little tight bundle. But the VA also has access to other records and information to use for that claim.
Fantastic.
But I don't know what that is. They just say they do.
One of the things that, I remember being in the military, and it would happen both, on drill times and also, when you were going for your, duty for like a 2-week, training, and then overseas, even in Iraq, that line of duty statements. How important are those? And, it doesn't seem like they're not really taking that seriously when something happens, and that those are really required to be filled out by, military rules. And I don't see them being filled out. So, where do those fit in?
Is that a great question? I don't see those statements very often. I know what you're talking about, okay. But that is a rarity if I find one of those in the records that the VA sends to me. Brent, you can probably do that better.
Well, I'll just say it's a great question because those line of duty determinations, if they're in the records, can be extremely helpful for verifying that there was an injury or some event, and that could be physical or mental health or whatever. But I think the common experience is that they are not taken that seriously, and often not done or not completely done. But I've seen them. I actually had a case of a veteran who injured his leg, and they did a line of duty determination. I was like really amazed from my perspective, trying to connect the injury to his service. It was great, but it's pretty rare, and I think that's my experience.
Yeah, because I think people need to pay more attention to that, especially it's really doing a disservice to veterans if, even in a combat zone, if you have someone who's, been severely injured with a TBI or, been rollover or, actually has been lost a limb even, that should be completed by the commander and, by making sure that that's done. Yeah. Yeah.
Absolutely.
So, how, in the rural areas, what do you think needs to be done? What do you think that we need to be stressing more, to help our veterans? I was brought to tears about one veteran who was in southern Illinois, and he actually had lost, both of his arms and his right leg, and he was really in a really severe combat zone injury. So he had some coverage, but it really wasn't enough. He was a farmer, so he had to get out onto the farm and actually had to work on things, but he couldn't do it. So his wife was working 2.5 jobs, right, trying to support the two of them. And it was just like he was just floundering. And it brought me to tears to see someone in that kind of situation. So, how can we help our veterans in the rural areas, and what do they really need for our legislators, for the government to understand that these services are needed there?
Well, one of the positives out of COVID and the pandemic and the lockdown is that the VA has eased up and is now utilizing telemed so much more than before. And with that means these veterans have access to somebody to help them at least know what their benefits are. Another thing, too, is the choice program. The choice program with the VA means that veterans can use their VA benefits in their community with providers that will accept the same payment and rate as they would if they went to the VA. So that's helpful. And the VA has, and it's not like I don't want to sound like I'm tooting the VA's horn, but they are making some progress.
Yeah, good.
Well, with doing these community-based outpatient clinics, which is also very helpful because for rural veterans, because these clinics tend to be staffed with people from the community, which is good and bad for rural. Good because you know and you can trust these people. Bad because one of the rural things is everybody knows your business. They know if you went in or out, or they have that. Yeah. But one of the best things has been the telemed part. But when you have a veteran from Southern Illinois, like you said, access to treatment, to help, to assistance, to services is just so much less, and that requires the VA to get creative, and they really don't know how to do that.
Yeah. Well, we're out of time, but we have got to have the two of you back. This is such a great this is such a great topic, but maybe you can give us, just one place that they can go to find out about the services you have, a phone number to call, And then we're going to have you back again because this is such a critical issue. And as I said, makes my heart bleed every time I see a veteran in a rural area not getting the services that they require.
I will tell you, if I have time, one of the best resources, mental health-wise, because I only know mental health, is the In Transition program. And it's a military DOD program. And if you go to Papa Delta, pdhealth.mil, and click on the In Transition program, they have 24/7 coaching, not emergency stuff, but coaching that actually helps veterans access their mental health benefits if they're out of medication, how to get it, how to do all kinds of access to mental health from where they are.
Okay,
and their coaching is peer-to-peer, so you're talking to somebody that's probably been there, done that, similar to you. But it's pdhealth.mil.
Thank you very much. Thank both of you. I really want to thank you, Brent and Amy, because you have done phenomenal jobs for our veterans. So we are so happy what you're doing for our veterans in the rural community.